Hi, a pleasant day to each one of you. I am Dr. Emma Gaspar Trinidad, a cardiologist at ManilaMed Medical Center, Manila. With me today are other members of the heart failure team of ManilaMed. On behalf of the Heart Failure Clinic, I would like to provide a brief course covering some of the basics of heart failure care. We shall be tackling the ABCDEs of heart failure care. So, the first letter of the ABCDE is A. This stands for avoid sodium. It is widely known that wherever salt goes, water follows. And for heart failure patients, too much water intake can lead to worsening of symptoms. To help us avoid excessive fluid in the body, limiting salt intake has been a key strategy for this. It has been studied that heart failure patients with mild symptoms should have a reduced dietary intake of only 1,500 milligrams or less per day. A guide for this is to approximate the amount of salt given based on the nutritional facts. For example, if a label says sodium-free, salt-free, or no sodium, this is equivalent to less than 5 milligrams of sodium or no sodium chloride in ingredients. Very low sodium is about 35 milligrams or less of sodium, and no added salt or unsalted is about 140 milligrams or less of sodium, while reduced or less sodium is 25% or less sodium than the regular product. These are some of the examples of food products and their corresponding sodium content.
Next, we have the letter B. This stands for balancing your fluid intake. This is a more personalized recommendation because your doctor may recommend 5 to 8 250 ml cups of water per day. This corresponds to about 1 to 2 liters, which also includes all fluids taken throughout the day. This covers any soup, drinks taken with medications, and the like. It is important to take note of any high liquid containing foods such as ice cream, gelatin, fruits, and vegetables.
For letter C, this is for controlling weight. It is important to always monitor for sudden weight gain or loss, as this also estimates the sudden increase in the fluid volume of our bodies. Especially for heart failure patients, an increase of 1.5 to 2 kilogram body weight in a day might be an early sign of fluid accumulation. When checking weight, it is ideal to have it checked during the same time of the day, wearing the same type of clothes as to accurately measure it. We should target a weight loss of 3 to 5% of our body weight to maintain our health. Lastly, greater weight loss will help manage your blood pressure, cholesterol, and other health factors.
Next, we have letter D, and it is, of course, for diet and exercise. These two always come hand in hand, as when combined, they offer additional preventive benefits for our overall health and especially for the heart. Another thing to remember with dieting is that we should limit the intake of saturated fats and trans fats. Saturated fats mostly come from animal sources such as meat and full dairy products, and trans fat is what we can get from hydrogenated oils as well as animal products found in hard margarine, vegetable shortening, commercially prepared foods such as french fries. Exercise that is accompanied with healthy eating can promote weight loss of up to 0.5 to 1 kilogram. Exercise should begin slowly, allowing a warm-up period before and a cool-down period after exercise. The Borg RPE, or rate of perceived exertion, can be used as a guide when to stop exercising. In most cases of heart failure, it is always best to consult with your cardiovascular rehab specialist for an individualized exercise prescription. Heart failure can present with 8 key symptoms that, when present, should be monitored closely for impending decompensation or complications. First, we have shortness of breath. Second is shortness of breath when lying down, which is also known as orthopnea. Third is rapid heartbeat. Fourth is a loss of appetite. 5 is tiredness or easy fatigability. 6 is swelling in the ankle area. 7 is sudden weight increase. And 8 is frequency of urination.
Letter E. Evaluate your symptoms. If you're experiencing any of these, like no new or worsening shortness of breath, physical activity is normal for you, no new swelling in feet or legs, weight check, no signs of chest pain, then you're doing well. Keep up the good work. If you're experiencing any of these, dry, hacking cough, worsening shortness of breath with activity, increased swelling of legs, feet, and ankles, sudden weight gain of more than 2 to 3 pounds in 24 hours or 5 pounds in a week, general discomfort, or trouble sleeping, slow down. You may need to contact your cardiologist or visit the heart failure clinic. If you are experiencing any of this, frequent dry hacking cough, increased discomfort or swelling of the lower body, excess weight gain but with loss of appetite, shortness of breath at rest, worsening dizziness, confusion, sadness, or depression, increased trouble sleeping, and cannot lie flat, stop. It should serve as a warning to seek consult or be evaluated by your cardiologist ASAP.